Asmita, should we wait for a couple of minutes to people to join in?
Yes, sir. We'll wait for 2 or 3 minutes more.
All right, sure.
We'll start.
A very good evening to everybody here. Welcome everybody to this outreach service subsection meeting. My heartiest welcome to Professor Tisa Vijayaratne, who has given his consent to be here and talk to us about the outreach at a global platform, how things are done there, so that we can have collaborative efforts as also lessons learned from his exemplary work that has been going on. And Dr. Siddesh, may I request first to give an introductory bio to Dr. Tisa Vijayaratne.
Yes. Good evening, everyone, and it's my pleasure being the convener of the outreach subsection of Indian Academy of Neurology to introduce our distinguished speakers today. Smita, can you have the slides, please? Yeah. Let me introduce Dr. Bindu Menon, ma'am, first. She is a senior consultant and head of Department of Neurology, Apollo Specialty Hospitals at Nellore, Andhra Pradesh, India. She has more than 100 publications to her name. Her special areas of interest are stroke and epilepsy. Her achievements, I can go on and on, but more than 20 international publications, more than 27 national publications. She's a recipient of Mridha Spirit of Neurology Award from the American Academy of Neurology and American Brain Foundation 2022, and A.B. Packer Teacher Recognition Award in 2022 from American Academy of Neurology. Now introducing Dr. Tisa Vijayaratne. He is a chair professor and director neurology, Western Health, Melbourne, Australia. He's a president of Asian General Regional Consortium for Headache. He's a global chair for SIG for migraine and headache disorders, WFNR, co-chair World Brain Day, WFN, founder and chair Migraine Foundation International, co-founder and medical director of at Australian Institute of Migraine. His area of interest are brain health, with a key interest in subspecialty training in headaches, movement disorders, stroke medicine. He has more than 270 publications to his name. He has been nominated for the post of Secretary General of WFN, 14 international awards and medals for outstanding contribution in science, education, and research in brain health. The clinician scientist for highest citation index and impact factor in his institution, with a citation index of 80,000 and IF 73. So very glad to have you, sir, for our first webinar on the outreach subsection. Let us begin with the webinar. First session will be conducted by Dr. Bindu Menon, ma'am, and she's going to talk about the power of outreach in neurology in India and how to build stronger communities.
Thank you very much, Siddesh. So, outreach subsection has been started recently and is one of the smaller subsections of Indian Academy of Neurology. This was brought in forth, keeping in mind the rural and urban disparity in the country and how everybody in the subsection can probably move forward and bring together and see that we can effectively come down on this disparity as far as awareness is concerned, as far as prevention is concerned, as far as diagnosis and treatment modalities are also concerned. So we should not underestimate the power of the outreach activity, and this will always help us to build stronger communities. India is a vast population, and as we know that there is a rural-urban divide here, and this is what our outreach subsection tries to across the country, trying to bridge this divide. This diverse population and a geographical challenge poses a significant barrier to healthcare access. Also, we know that the neurologist to the population ratio is very small. That is one neurologist per 1 lakh population. And more so, they are all bottlenecked around in the urban areas only. None of the neurologists are there in the rural sector. A couple of neurologists do reach out in various forms. We know in our outreach subsection itself, we have Amta reaching out in her train services, Dr. Nilma Surya reaching out as camps. We may do our neurology on wheel services and several others whom we are probably not even knowing because we have not been able to catch them. So but then still then it is a low neurologist to population ratio compared to the developed countries. And then this bottleneck phenomenon creates a big barrier to us. Then if we would look at this map over here, we can see that the population wise also, because it's such a populated country, if we will look at that, the population of Kerala is equal to Saudi Arabia. The population of Karnataka would equal to population of UK. So the population of the country and the geographical disparities is one big challenge which will always loom large. The resources are also limited. There are insufficient infrastructure and resources, but then again, the cities are boast and are proud of the best services in all the diseases. But then if the flip side of the coin is that we do not have even the essential drugs for treatment of a simple ecosprin, which might not be available in a rural PHC center in some of the places. There's also a stigma and awareness. We know that the huge population crowd continues to move for a native medicine that goes for stroke and epilepsy. And some of my colleagues can vouch for that, that when they go for their camps, we can see that even though the treatment outcome is very poor, the services are still continued in that subsection of population for that subsection of treatment modality. The disparity, as I said, this urban-rural divide looms very large, and there is a socio-economic groups which can be formed. The key roles, how we can do is we can bridge the gap. We can bring it to the underserved population. Preventive healthcare, which our esteemed speaker is going to talk on, is most important because none of the patients, as we can say, the patients might not reach in the golden window period of 3.5 to 4.5 hours. But then we can always work on 80% of prevention for stroke. We can always work on patients getting the bare treatment for epilepsy so that they do not have injuries, they do not have to move into the status epilepticus, they do not move into a refractory state because of an untreated epilepsy part. We can also have specialized care like stroke services. We can have special groups for stroke. We can have the hub and spoke model for stroke. We can have centers where we can have epilepsy training camps, that is training the trainers. We can have the PHC doctors which can be trained. We can have Parkinson disease support group. Parkinson disease movement disorder society is one which is started by Dr. Singhal, my teacher. And we are having multiple chapters across in the country. Telemedicine is one thing which is not utilized well, but it should be utilized to the potential because we know that India as a sector uses telecommunications to the most and also has internet services to the maximum. So one should use that and how we can incorporate telemedicine into our remote healthcare. Training the trainers, as we said, is going to help a long way. And with artificial intelligence in place, maybe probably algorithmic approaches which can be given to PHC doctors would be a game changer. Not now, probably in a decade from now. And then crisis response, which will definitely help for immediate assistance during the emergencies and disasters. This is a place where telemedicine hub and spoke model, a couple of our doctors do that, and we also do it in our center, which can help in the crisis response in these patients. They are the key roles of an outreach service where we can do this and not restricting to these 6 numbers. But then nothing is possible if there are no stakeholders for it. An individual doctor and individual neurologist cannot do. As you can see, my job is to paint, so cleaning is another department's job. So if we do not collaborate with each other, nothing is going to happen. And for that, we need investments. As we understand, we should have stakeholders, the government organization, the politicians, they should be incorporated into the programs because unless there is an investment, the resources are not adequate. The thought and idea process cannot percolate into the general public. Collaborations should be there, not only with healthcare providers from the rural, urban, the PHC doctors, the community health workers, the community organizations and government agencies. And then obviously the raising awareness from the preventive part, from the diagnostic part, and from the treatment modalities which are available and which are certain time-sensitive diseases which should be approached in time. If that is not done, then the disease might have a large morbidity and a mortality as well, should be emphasized in these programs. Thank you very much. Mute. Siddesh, you are mute.
Thank you so much, madam, for the insights. Now let me invite Dr. Tissa Vijayaratne for his talk.
Thank you so much for having me today. It is a pleasure and honor to visit your beautiful majestic nation, even virtually. And I'm delighted to see that Indian Academy of Neurology is taking a significant initiative on brain health and prevention. If we go back to Professor Menon's last picture, the road and paint, I couldn't stop thinking how one of the cleverest human being ever to walk on this planet, if I remember correctly, almost like close to 3,000 years ago. Those days the place was called Lumbini, now it's called Nepal. We didn't call it Nepal at that time, at least as per history. Then he attained the highest amount that any human being could ever achieved, to the best of our knowledge. Even with Nobel Prize psychologists or psychiatrists cannot break what he discovered. And then single-handedly walking along the river Ganges and then convert the way humans think, way cleverer than anyone else who has ever done. Started with absolutely nothing, no TikTok, no YouTube, no the Zoom calls. Of course, we are not as clever or even closer to him, but I think with our hearts and souls put together, there's nothing that we can achieve. And if there's a nation who can show the world how it can be done, just like he has shown the world a few thousand years ago, I think time is right for you all to take the lead role and show others how it can be done. In fact, in this audience itself, there are multiple speakers who could do this talk a million times better than me, having seen what they have been doing. I won't name them. Bindu already mentioned some of those names, and I'm sure there are other names that we don't even hear. But anyway, I am here, and it is a pleasure, it is an honor, and I will try my best to share what we have learned at locally and internationally along this journey. So the plan of my talk is, I was going to talk about Lord Buddha anyway. I like what he preached, and I still try to understand what he was trying to say, and I haven't even understood one drop of what he was trying to do, despite my best effort. That's why I claim him as one of the highest who ever walked on this planet, who belong to the soil, basically, or your land. I'll talk about brain health a little bit. I won't bore you about this. There are multiple definitions. You can Google them. You can look into the WHO side or AN side. I'm sure Indian Academy of Neurology would come up with their own in time to come. But I'll try and mention why we should know what IGAP is. Again, I'm not going to go into detail. You will have opportunity to learn about Intersectoral Global Action Plan. And the brain decade. I'll talk about this region which I deeply care about and what can we do, and then I'll try and invite you again to join this journey. So if I ask from you to pick the difference on left and right hand side, which I'm not going to quiz in the interest of time, you would not know which half is this, which half belongs to which one. The one half actually belong to a mice and the other half belong to the human. You can see that at neuronal level, unless you are a molecular biologist, it is very difficult for you to pick how we piece a primitive animal from so-called the most developed, most evolved animal at cellular level. Then what makes us unique? What make a simple human being, yes, who was born to a king and queen, to dissect the human mind way better than anyone else that even can't comprehend in 2024? The difference is this, the difference is brain. You can see that how 67 of us in this Zoom call from different parts of the world, different parts of India. I am currently in Melbourne. I'll be in Canada in a couple of days' time, and then I'll be doing similar talks to other parts of the world. We do all these things because of our brain, because we establish networks and we cross-question, and we are basically a direct repercussion of this amazing organ. Obviously, this audience doesn't need me to tell you. This is from one of our slides from last year World Brain Day. A few years back, I wrote the same thing in 2014 also. It is the most amazing and complex organ in our body. It is what creates us for good, bad, or ugly. I thought for a fraction of a second in the middle of pandemic when we were learning how to do these Zoom calls regularly. I think many of you were helping me to run virtual symposia. I think one time I had almost like few hundred neurologists from India joining us on a virtual Asian meeting. I thought that we would solve most of the global problems and we would be a peaceful, civilized humans. But how wrong I was. This morning when I calculated, we have almost like 188 active conflicts globally right now. So it is good for bad. For both, this organ is responsible. But the sad truth is the disorders affecting brain or humanity is the number one cause of disability, and almost the 1 in 2 of us are having a brain disorder whether we like it or not, given the latest GBD iteration that many of you are privileged to co-author. This is one of the slides that I borrowed from Matilda Leonardi from WFNR a few months back. The global context of burden of neurological disorders are huge and immense. They impact low to developing countries and the developing areas of developed countries such as Australia, more so compared to other parts, creating a double whammy. So this paper, I calculated there are many of you in this, the authorship. I took some of the names away so that this was not done with particular respect to one group or the other. So if your name is not there, it was not done intentionally. I just wanted to show you that I was part of this group. I'll come to this point. What I wanted to show you is there are differences between the neurological disorders impacting different parts. This is where India is, Southeast Asia. This is where Australia is. While stroke is your number one cause of disability, migraine is our number one cause of disability here, and stroke is still the number one cause of disability, my other home, Sri Lanka. So this is your top 10 from the top order. Your top, the cause of disability is stroke, then neonatal encephalopathy, then migraine, then preterm birth, then dementia, then diabetic neuropathy, epilepsy, meningitis, encephalitis, idiopathic intellectual disability. So the list go on and on. So we just need to be aware of them. Having said that, there aren't enough decent studies in migraine coming from India for us to make sense about this. So the same can go for some of the other things. I didn't have time to study into detail to show you what work needed to be done. You have ample amount of clever brains in your organization to do that and do the justice and show the world how this can be done. So that's the size of the problem. Now, both India and Sri Lanka have been almost destroyed to close to zero by invaders to these nations years back. Then some of our ancestors have to rebuild from the beginning. That's why when you go overseas, you can see most of the important things from India, Sri Lanka, Congo, and other parts in some of the Western world museums that many of us have seen. Despite that, almost 2/3 of the world population live in this part of the world, 4.72 billion last time when I calculated. If you add Africa, that's nearly 85% of the global population. This is why Indian Academy of Neurology and the EU lot have a huge responsibility to support us and bridge these gaps and then take other small nations around you with you and becoming the sort of a father or the mother, the neurology body supporting them. Your journal should be everybody's journal in that context so that they create a voice for all these people. it goes without saying that prevention is better than cure. And I believe at this point of time, over 100 million people would suffer from what we described as post-COVID-19 neurological syndrome a few years back. And then the number of headaches that I deeply care about is probably close to 3 billion people. And the well over 100 million people live with disabilities of stroke. Almost close to 90% could be prevented. The latest GBD iteration says 84%, but Valerie Fagin, with whom that I work very closely, tells me that it is more probably close to 90%. Even dementia, almost 40% could be prevented. I had a look at 7 deaths in Australian football recently, and the postmortem studies show that there are 7 pathologies in their brain beyond chronic traumatic encephalopathy. Nothing is pure in that context. So vascular protection and vascular prevention is immensely important. So that's why I pointed out to you that diabetic neuropathy is a cause for concern in India. As you know very well that diabetic neuropathy is closely related to vasculopathy also at the same time. Then out of over 50 million epilepsy, there's reasonable data that suggests that almost 30% could be prevented. So we need to look into those things. And you might say that multiple sclerosis is not a big deal for India, but given your sheer size with over 1 billion people, you have more multiple sclerosis patients than any other nation in the world, or almost any other nation in the world. So you do they have other problems, as effective therapies are prohibitively expensive, and your patients can't afford them more easily compared to rich nations like Australia. For that context, it is much easier for a rich country to look after just over 20,000 patients rather than a large number of patients that you have to deal with. Now let me change the tack to how we started with the World Brain Day journey. You're very familiar with World Brain Day. We have written about this a lot. There are well over 30-40 publications. I selected a couple if you wanted to go and study the history. I think we have created about 400 videos in YouTube channel talking to various people. This is while we still have a long way to go, this is again the power of communication and collaboration. The whole idea of World Brain Day was born, if I remember correctly, around 2011, 2012, as a casual chat between myself and Mohammad Wasey from Pakistan, and later on Vladimir Hachinsky, as a sort of corridor casual chat. We saw the power of World Stroke Day. Then I saw how little bit of push from myself the help Sri Lanka to win the World Stroke Day Gold Award, while stroke was not heavily involved by the neurologist with a brown skin at that time. And with a couple of casual conversations and big international meeting that we held in Colombo, Mamita is in the audience. She may remember that we were chatting about this in the Palatucci Advocacy Forum later on. To our surprise, we pulled together a massive educational campaign in Sri Lanka that beat most other countries, winning them gold award. Then we wanted to bring this to WFN, and we felt that how about we talk about brain health, because nobody is talking about brain, or how about the World Brain Day. Then Wasey was the advocacy committee chair in 2014. Professor Hachinsky asked him to make the proposal to the Council of Delegates meeting, and that was unanimously voted in. As you know, you are one of the most active the neurology societies in the world, delivering the world probably the best the World Brain Day campaign year after year. That is because people like Chandrasekhar Meshram, the Bim Singhal, and many others have already done community work, so it was easier for your colleagues to translate, to transform the toolbox and other things that we were creating. Now, I think time is right for us to drive home the message that many brain disorders can be prevented, and then taking the lessons. How could the Siddhartha Gautama, having left his power as very powerful king's son, managed to communicate really deep, difficult concepts to the extent, as I read, that the many youth, the leaving the economical prosperity for spiritual prosperity, what can we learn to promote humanity and prevent brain health, or the promote brain health through preventative measures using all the technology and technological advances that we have? If we are having like over 188 conflicts, basically promoting bad things in the world, surely if we put our hearts and souls together, neurologists are supposed to be the cleverest physicians in the world in internal medicine discipline. We are supposed to be the queen of internal medicine. Most of us are good-hearted people. We have good brains also. So we must be able to get this job done now. I firmly believe that time is now and time is right. And you guys are the one to do this and show the world. Yes, we can create at global things, but if we see things delivered at your massive nation, nobody can argue that if you guys could pull this together to cater for over 1 billion people, countries like Sri Lanka with 23 million people, or countries like Australia with 23 million, can't basically complain, can they? So the opportunity, the intersectoral global action plan, again, I'm not going to bore you with what it is, but you must know. If you are hearing it for the first time, just Google intersectoral global action plan. Myself and many others, WHO, WFN, the academy has written about it, talk about it. It's basically, as the name stands for, intersectoral, in other words, between sectors, global action plan. We have already completed like 2 years. So what it is, all WHO health ministers, including Indian Federal Health Minister, including Australian Federal Health Minister, including Sri Lankan Health Minister, including all WHO member health ministers, they signed up to put brain health as a priority, to deliver brain health preventative measures, and the list go on and on. So that the political leadership has already signed this up. That's a big win. And WHO, since 73rd and 74th Assembly, on the back of the International League Against Epilepsy and International Bureau of Epilepsy's good work, I recall the next president-elect, our friend and good colleague, WHO trustee, Professor Alla Gett's work on this with the rest of the other colleagues, that is now there for us. Very soon, World Health Organization would release the Intersectoral Global Action Plan Toolkit. It's a really nice, useful toolkit, and that will be available for all neurologists and all neurology societies. Then we have completed really successful 10 World Brain Days, and you guys are the rock stars in World Brain Day. You guys produce World Brain Day things that no one can match. I want you to double the effort or triple the effort and give us the most successful, most massive World Brain Day campaign ever, because we are talking about prevention this time at grassroots level. I have mentored a large number of doctors and medical students. The doctors that I have mentored are beyond few thousand, despite I'm not quite old yet. And I have been teaching medical students across continents regularly. Some of them went on to become dean. Some of them, most of them have gone way beyond what I could have ever achieved. But out of some of them, this is not a criticism against them, I see some with increased body weight, some with increased abdominal circumference, some with untreated or not very well controlled diabetes. So there seems to be some sort of a dichotomy with the way that we communicate this preventative message, even for educated crowd. But I come from one of the most rural parts of Sri Lanka, so I hear and feel the pain that Bindu and Sidesh is talking about. I am acutely aware of the disparities between rural and urban as I cross-pollinate between two nations regularly. I spend significant amount of time in my rural schools and rural villages back in Sri Lanka more often than not, to the extent that my hospital generally up until a few years back had regular the inquiries or complaints that while they were paying me that I was working for Sri Lankan hospitals and Sri Lankan universities, but they were not based on quite solid evidence, so I still work in Melbourne. So I think despite that, it is time for us to reverse engineer with really grassroots level advocacy, pretty much similar to what the Buddhist philosophy was expanded at that time, a few thousand years ago, across that region at least. You could see that where him and his followers could walk, the message went across with some changes, as there was no written communication at that time rather than verbal communication. So how about we try and reverse engineer this with grassroots advocacy? Some thoughts to think about. So some of the things that you might target involved selecting schools. The go ahead with different schools, target school captains, target spiritual groups. You have a really sports mad nation, but most of your cricketers and cricket stars are reasonably approachable, at least in airports and overseas every now and then when we meet them. And every Indian meeting that I have attended to, I had to talk to some political ministers. I get the feeling that you have ready access to most of your political leaders. You have ready access to most non-governmental agencies. Most of my friends and colleagues in India work for big universities or run big institutes. You seems to have media at your fingertip, whether it is television or newspapers. Again, most of my colleagues, the clips that I'm seeing, they seems to be more TV stars rather than neurology stars. I sometimes joke at them, are you now work for Doordarshan or are you now work for this, the Indian Neurology Institute? And then you have some of the very best local experts in your home country. Make full use of them. And remember that you produce human beings to this world who change the course of this world more than anyone else. Despite, and your economy is booming and people are watching the rising power of India. Let's bring that to brain health and preventative brain health and preserve humanity. This is definitely possible. This is definitely possible, and this is definitely achievable during our lifetime if we put our heart and souls together. I'll give you now some examples of what we managed to do by taking some of the examples. Now, just to put things into perspective, you might think that, oh, it is much easy for Tissa to do this. He doesn't have to do the same amount of private work like we do. He gets paid from Australian dollars. He lives in Melbourne. Obviously, he can do all those things. But when you are a migrant neurologist, you face your own challenges. You have to remember that you are competing for grants and other things with zero network. You didn't go to a medical school here. You don't have your friends who are working as deans or full professors in other campuses who are reviewing your grant applications. And then you have a surname with Vijay Ratna. It's not Smith or Anderson. So all the sort of bias and rest of the other things are in full flight working against you. But despite that, we figured out, I think if I remember correctly, around 2006, 2008, while I was spending half of my time supporting the Sri Lanka stroke service development, we realized that the leading cause of disability in Australia is costing Australian economy way over $40 billion, and the really hardcore headache gurus that we made left Australia because they had no opportunity to do research and other things. People like Peter Goadsby and others. There was no functioning headache society, despite we gave birth to Jim Lance, who was one of the International Headache Society presidents. And despite being a super rich country, the national funding for headache research was less than 0.007%. but no one has written about this up until we started doing them. So we started writing about them, talking about them, and shouting out building a headache society and making headache a big deal, and the bringing the much needed attention as best as possible to that. You probably don't know these two people. We can't become TV stars in Australia easily. These are the same people who the interview Australian Prime Minister Michael Rowland is well known. On 2019, when we were running the World Brain Day migraine, they gave me 10 minutes to talk about that. I was talking to every ABC radio station throughout the day on that time. So this is very...
Now, migraine is the world's most common brain disorder, yet it's also one of the most underdiagnosed, undertreated and under-resourced neurological diseases.
It's something that the World Federation of Neurology is determined to change, making it the focus of this year's World Brain Day. Professor Tissa Vijiratne, who's a neurologist from Melbourne, is the chair of the campaign and he joins us now. Morning, Tissa.
Good morning,
Good
Madeline.
morning.
So,
Now, migraine...
so we had then after a couple of years later, we managed to put together first Australian Centre of Excellence in migraine with a little bit of support from a couple of universities and a couple of political leaders, with all verbal, so not sort of financial support, but they started a research program and other things, and then we put things back again, and hopefully you can see what we are going to be doing in a couple of days' time. Did you know that your eye is the window to the brain? Come and join us on 16th of June at Flagstaff Gardens with World Migraine Day Brain Health and Prevention campaign. You will have the opportunity to come to one of our stores and take a picture of the back of your eye and then get a prediction of how healthy your brain is. This is an Australian first. Come and join us and be part of the history. We'll see you on 16th of June. So I think on 16th, what we are going to do is the platform is nicely set on one of the beautiful gardens in Melbourne City, where we would be demonstrating 2 hands, 10 fingers brain health prevention hubs. We are going to talk about 5 behaviors, 5 numbers: eating healthy, sleeping healthy, being physically active, be the nicest human being that you can be, managing stress better, not smoking. Those are behaviors. The numbers, you know them already: the body weight, the abdominal circumference, blood pressure, sugar, and cholesterol. And this is with zero support from the federal or state government, with a whole lot of volunteers and bunch of medical students and high school kids and high schools that we managed to brainwash on importance of preventative measures in brain health. So imagine that if you manage to get schools, local governments, I'm lobbying Australian local government saying that you guys drop dustbin and other things. How about the main thing that is bleeding you economically? The brain disorders, the dementia, the stroke, the epilepsy, the head injuries, migraine and headache disorders. Put preventative aspects and try and save that money so that you can use that money for other purposes. Believe it or not, they are receiving it really nicely. So I'm hopeful that this reverse engineering thing just might work. We just have to put our heart and souls together to get this across as best as possible. It is such a rewarding thing to see that 18, 19-year-old boys and girls taking this on and then spending their school recess and other times to do brain health prevention games. Small numbers yet, but remember that when Lord Buddha walked along the Ganges River, it was just himself initially. Then it became a massive phenomenon later on and still exists today in different parts of the world. So I think these slides are not released for the global community yet. You will have them later on. So I'll quickly the run through them. The core campaign message is going to be on IGAP and preventative measures, brain health and prevention, protecting our future. You know the leadership of World Brain Day well. Wolfgang, myself, and David Dodik. I already mentioned to you about why prevention matters. You know these numbers, they are on WHO website and WFN website already. Our key messages are basically saying that brain disorders are preventable through early detection and effective management, and they are preventable by primary prevention also. And global education on prevention is really, really, really important. It is even more important where disparities exist. We absolutely have no chance if we don't invest on prevention. My rural hometown that cater for like 3 million people is the most poor part in Sri Lanka, and that entire region is catered by one single neurologist. But believe it or not, people seems to access him faster than people in Melbourne accessing me. So healthcare professionals, researchers, policymakers play pivotal roles in addressing the neurological needs, but we should not underestimate the grassroots power that I showed you before on how we managed to deliver migraine-related work in Australia out of nothing within 10 years. I personally believe that brain health is a fundamental human right for all of us. I think if we don't get this right, our species is gone in another decade or two time. You will see access to all those things. And with that, I might stop here, and I'm happy to take any questions.
Thank you very much, Professor Vijayaratne. That was an excellent talk on the challenges which you yourself faced and how World Brain Day evolved, and the insight into all of the activities that you do. There are some couple of questions. If I may take the first one. Which partnership or collaboration do you find is more effective? Do you feel that partnering with the government agencies is more fruitful, or corporate sectors are? We can stop sharing the slides, I suppose.
So that's a great question. So I would say all partnerships are useful. I basically the key thing is even if some partnerships are potentially hurting you sometimes, I would still take them in the open hands. Obviously, because this, you see, the size of the problem is huge. This is not something that we can do by ourselves. Our job is to bring people together as much as possible. So whether it is government, corporate, colleagues, patient communities, sometimes there are challenges because different people have different agenda behind them. So you just put the importance of the cause and then you collect the resources as much as possible. Sometimes the certain partnerships you might see as barriers. You then back off and then work with others, and still don't ignore them completely. And you might get them back later on when they see the value of what you are doing. So I would say all of them, but obviously more collaborative partnerships, irrespective of where they come from, where you can get to the goal faster, is useful. I'll give you an example. When we set up the Australian Headache Society, although I wrote the constitution and it took like almost 4 years for me to gather 5 neurologists to establish a charity in Australia as per Australian rule. I just couldn't collect 5 neurologists from, I can't remember, for the first couple of years. But once we established, there were a lot of people who were wanting to take the lead role and who prefer that to be from this hospital or this appearance or this way of communication. So you then back yourself off and still let them, you support them, because remember, the ultimate goal is not you to be accessing something. Ultimate goal is fixing this issue. Then I went ahead with patient groups and established a charity, and then decided to walk up to the street and raise awareness. That seems to make things happen much more faster. So you just work with when barriers and blockages come, you think about, well, I am fighting for this cause. This is not for me to gain anything personally. Therefore, this approach is not working. I'll try something else. I let this group still run its own course. Eventually, everything gets aligned. Same thing with World Brain Day. I remember for us to get migraine into World Brain Day, I can't exactly remember. It took like 3 or 4 goes without naming people. I think once I heard from the leadership that no, this is not an important topic for this. You should bring it. I can't remember that whether they said that or not. It wasn't sort of regarded as a really the group didn't feel that there would be take up from the world for this. But then again, 2009 World Brain Day was one of the most successful World Brain Day campaigns that we had ever. As I said, it's a long answer, but I would say that take everything that comes on board. Nothing is going to be easy. Sometimes challenges occur, but don't get too upset. We have one life, at least to the best of our knowledge. Although we have different beliefs about afterlife that may or may not be true, we need to make full use of this life to benefit others, and for us to be really happy with how we have spent our time on this planet. And for that, I would work with anybody, basically.
Thank you. Thank you so much for that. And the question is that when we are working on to promoting brain health and also for preventing the neurological diseases, now we are working across different age groups. Now it goes from schools, colleges, because that's where we need to probably pitch in so that we have a healthier brain across now. They are different, the school, the colleges, and the youngsters and the adolescents, they would more go into the social medias, and where we can, now we're looking at more elderly population who are already having diseases. They would fall for one-to-one physical. So how do you sort of strategize? What key strategies would you have to engage the community across this whole spectrum, given the time constraints that a neurologist would have?
I think this is a very good question, and I was kind of expecting this question. And I have 2 children. Both of them are studying medicine at Monash Medical School, one in 4th year and one 1st year. Incredibly smart, both of them. But one doesn't believe in healthy living or healthy lifestyle. They are still very young, and so I educated to both of them about the importance of reading food label and being nice to each other and this and that. That's all good. When I ask from one of them, I'm doing this talk to my colleagues in India, there's surely going to be a question that how do you approach the promoting brain healthy messages to well-educated people who knows what they should be doing, but they are not doing it. My relevant child answer was that it's a difficult question to answer. Maybe they don't think about the consequences that they should think about when they hit like 23, 24, 25 like age or later on. And then the communication went through text, and the last text was I'm in the bush doing some birding and I can't answer your question. I think I'm not suitable to answer this question. So coming back to more formal answer, I think the trying our best to explain why, in other words, starting with the word why we need to be doing that, and then hopefully getting that seed implanted in their own heart, and then getting them to they walk the talk with us is ideal. This is difficult. That's why I said that we would like to learn from you all, and we would like to learn from others. I think this is probably part of the reason that I spend a lot of time at the community level. When I get high school kids and when they run things at schools, it's much easier for them to get their peers to spend part-time recess doing brain health prevention games rather than us. I see the same thing when I talk to elderly community groups. Australia is a very multicultural country, and every time when I go to those community groups, once you implant the seed, once you get a sort of a champion within themselves, it's easier to follow the process. It's easier to get them out. You must have seen the walkers in the migraine walk, the little video clip that I showed. It was very much multicultural, not the sort of a blue healers or home away episode that you would see in Australian television. That's actually the real Australia. Real Australia is very multicultural. It has a lot of migrant community, so you could get them involved in that regard. I think some of the things that I learned over the years is explaining why. But I showed you from my own children that there are challenges that I mean, these are kids that you brought to this world, and you are responsible for how you raise them. And yet certain messages you have difficulties communicating to them despite they are super smart. Those are the challenges that we face. But I still believe that our job is to try and explain why we wanted to do this, and then get them to join us. And if we can't, then work together to find a way to do that. I think part of the problem is, remember that if you speak to 100 neurologists, almost 90 of them would say, what is eye gap? It is not relevant to me. Why should I care about brain health? It's not relevant to me. That's the same in Australia also. And it is only now the American Academy of Neurology has changed its vision statement for brain health for all, like few months ago. And European Academy of Neurology is taking a brain health initiative only during last couple of years. And most of the Asia-Oceanian neurology groups, apart from India, I haven't seen any useful effort put in to promote brain health. I've been pestering my colleagues in Sri Lanka, so they now go on television to talk about it only since last year. You will see that the Asia-Oceania meeting that we would be having in Japan, that some of you would be attending, there's only a little bit on the brain health, but that's also after a lot of lobbying that we managed to get in there. So we are talking about convincing our own colleagues, and I'm talking about two children that me and my wife are trying our best to raise to be the best for themselves and to be the best for others, whatever the path that they want to choose. They choose to do medicine. We did not pressure them to, or not that they are listening to us anyway, to do that, but it is still hard work. So you are talking about how we convince this to the community. It's not easy, but again I go back 3,000 years ago. How did he do that? How did he manage to convince a prosperous, really super rich nation? That's what the book say. He chose to born in that place. That's the best place in the world. That's the richest community, most educated universities in village to village. And how did he manage to convince them to the abandon everything and the walk away from all the material things and build a spiritual life, almost to the extent I read that that became detrimental to the economic prosperity of your nation at that time. If you watch Buddha documentary, although you may argue that it's not completely true, I think there's some truth in it. So if he could do that with zero technology, no vehicles, no internet, no TikTok, no YouTube, no marketing services, can't we get this thing right? We should be able to. At least we should keep trying, because if we don't keep trying, we are doomed. We can't continue to say that we have 188 conflicts in the world if the world keep moving along this way, I mean, I haven't even talked about One Health at all. We do know that the some of you are part of the latest iteration of Stroke GBD paper. I don't know whether I can say this. It's under review at the moment. We are going to tell the world that global warming is a contributor for stroke, and global warming is going to kill strokes. So we are going to be vanished, whether we are Indian, Australian, Sri Lankan, Russian, or Yugoslavian, doesn't matter. If we don't take care of our brain health and One Health in a more collaborative way, our species is gone. So it's really imperative that we get this job done, and we get this job done right. And your nation has an enormous responsibility, just as that gentleman did 3,000 or so years ago. Now is the time with the bit more science and evidence base and technology to help us to get this message across, hopefully.
Thank you very much. I suppose the strategy which Gautam Buddhaji has followed should probably explode in this present setting. And thank you so much for your insights. And I suppose each one of us would probably take something out of it and try to modulate it in the present setting, in the scenario where one works, and come out with something for the World Brain Day, so that, as you said, would make it more effective than what it was in the previous years. Thanking all the participants, the IAN team, Siddesh.
Thank you very much, and all the best.
Thank you very much.
Thank you. Thank you everyone for joining. And thank you everyone for taking your time from their busy schedules and joining us on this first webinar. We have many more to come. And please join us for the next. Thank you.
Thank you, Bindu. Thank you, Sudesh. I'll then.
Thank you, sir. It was a pleasure. It was absolute pleasure. Thank
Keep
you.
up the good work.
Thank you,
Thank you
sir.
so much. Thank you. Bye-bye.
Bye.
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 Bye.